This is CNN.
I want to talk now with Dr. LaMar Hasbrouck. He's a former senior medical officer with the CDC. He's a former Illinois State Health Director and former County Health Commissioner in New York. So you're bringing so much expertise to this, Doctor. We appreciate you being here to share it with us. Vice President Pence, he said also that the Department of Defense could help fill some of the void with these shortages of medical supplies, like Barbara was just reporting, but they say they aren't ready to release that equipment yet. Is this something that can wait?
No. I mean, actually, the thing that's most troubling to me is I keep waiting for the administration to really mount the full court press. I mean, I think I heard Sanjay Gupta saying a little bit earlier, it seems that, our government is slow walking this whole response to the epidemic, and that our response is not commensurate with the state of emergency.
So they also talked today about the FDA clearing the way for more testing. They talked about how states would have more freedom to conduct tests. What do you think about that?
I think that's a great idea. I think it's long overdue. Again, I think that, it's time to mount a full court press and everything that we can do to get a better handle on what this epidemic is doing, or this pandemic here in the States, is important. We have to pull all the levers now. I don't know what we're waiting on. I like the stricter guidance, but again, I think we can do better.
Okay, so then one of the other things is this idea of 10 people, the gathering no larger than 10 people. This was something the president reiterated. This is part of his 15-day plan. What do you think about that measure, 10 people?
Well, I think that it's a step in the right direction. I think it does set a tone for kind of the importance of social distancing. I'm glad to see state and local governments really looking at all these recommendations as a floor and rather than a ceiling, as many of them are being actually more aggressive than what's being suggested. I think in terms of what everyday people should know, it's really more important to know the rationale behind it, or the science of disease transmission, than an actual number. It was 50, it was 250, it might be 6 tomorrow. But if they understand the rationale behind it, less people, less risk, then I think they'll self-police and they'll kind of naturally do what's right. Sometimes they may be in a group of 15 or more. Sometimes it's less than a dozen, or less than 5. So I think it's important to get that message across: less people, less risk.
As I mentioned, you were a senior medical officer at the CDC for 10 years. What's going on at the CDC right now?
Well, CDC is they're a data-driven agency, data-driven, data-informed, so they crunch a lot of numbers. They're going to be monitoring, or what we call surveillance, not only the coronavirus, but also probably influenza-like illnesses, other illnesses that can help to overwhelm the medical system, as we're bracing ourselves for that. They're going to be using that information to really adjust and refine some of the guidance. They're going to probably try to get a better handle on the testing across the country, really the density of the tests as they spread out across the country. Folks want to know how many tests are being done, and we know that if we're not doing adequate testing, we don't have a real good handle on what's going on. And then I think lastly, and more importantly, or most importantly, is their communication strategy. They need to get on messaging, because unless you have a single overriding health communication objective, the general public is kind of at a loss. We're kind of in the dark.
Dr. LaMar Hasbrouck, thank you so much for joining us. We really appreciate it.
Thank you. Thank you for having me.